Members of Congress, thank you for allowing us to join today. We are here to talk about a concerning issue affecting Nevada, namely the state of our mental health care system. Nevada is currently the lowest ranked state in the country on mental health prevalence and access. An estimated 18.5% of people in Nevada had a mental illness in 2014, and more than 4% of them had a serious mental illness. 67.5% of state residents with a mental illness don't receive any treatment, and 16 out of 17 counties were considered having professional shortages areas in 2016. We are also the lowest ranked in youth mental health. Throughout Nevada, mental health is ignored, whether through the low counselor-to-student ratio or the drastic cuts in funding by the state government. There are only 1,000 counselors servicing the student population of 500,000, a ratio less than half of what is recommended. Nevada has one of the lowest rates of access to mental health services for children and adolescents, at only 29%. Nevada made cuts to its mental health care budget of nearly 29% between 2009 and 2011. Nearly 20% of elementary students in the Clark County School District needed mental health services between 2008 and 2012, and only 30% of those who needed them actually received it. This means that children in Nevada with mental health issues were less likely to receive care when compared to children in other states. In the Clark County School District alone, there were 778 suicide prevention protocols implemented in the 2012-2013 school year. The DHHS has identified children's residential behavioral service as a major gap in the 2015 needs assessment. Suicide rates have reached levels we have not seen since the 1990s, observing 650 suicides in 2016. Suicide is the 8th leading cause of death in the state. For ages between 10 and 34, it's the 2nd leading cause. Nevada spends drastically less on mental health services compared to other states. Only $89 per capita compared to $205 per capita in Arizona. Nearly 1/3 of Social Security disability claims are for mental illness. The prevalence rates of mental illness, its early age of onset, and the impact of untreated mental illness warrants a strategic public policy response that goes beyond only advocating for increased access to mental health services in schools or through community lineages. Mental health literacy research strongly suggests a role for public health education in schools aimed at providing students with the information they need to protect and preserve their own mental wellness and the mental wellness of those around them. The cost of not teaching young people about mental health cannot be overstated. When mental illness, or even merely the early seeds of illness, go unrecognized and untreated, a cascade of unfortunate and sometimes tragic events is set in motion that are not only emotionally devastating, but financially crippling for the individual and the health system. Now Tim will discuss mental health literacy and the lived experiences of people with mental illness.
Thank you very much. So people in general, and young people in Nevada more specifically, are just not mental health literate. Mental health literacy here is an extension of the concept of health literacy and is defined as knowledge and beliefs about mental disorders which aid their recognition, management, or prevention. The term mental health literacy actually can be credited to the work of Australian researcher Anthony Jorm. Now, this lack of literacy can result in a failure to recognize and treat mental health disorders. The stigma surrounding mental health stifles the conversations necessary for individuals to seek treatment and keeps individuals unaware of the burdens mental illness manifests. Unrecognized, untreated, and late-treated mental illness elevates the risk of mental health crises, such as suicide and self-injury, and diminishes prospects for recovery, contributing to substance abuse and other damaging negative coping behaviors. The first signs and symptoms of mental health problems, some of which develop to the point of becoming diagnosable mental illness, begin on average at about 14 years of age, right in the middle of the school zone. Many adults miss or dismiss these early signs and symptoms, and young people are even less likely to recognize or understand what is happening to them. And even when there is some recognition that a young person is struggling, stigma often causes people to ignore, dismiss, or rationalize a child's true need for help. We can see these issues in a very real way today. Amber Simmons is a 24-year-old girl from the Clark County School District in Nevada who suffered from mental illness throughout her education. As she reflected on what was difficult in her experience, she highlighted for us what she wishes she had known in high school. So I'm going to read her statement now. It's okay to ask for help. This is a big one I've learned in the last year. If you're struggling, get the help you need. It is so scary to ask the first time. I was so scared of even saying the word depression, but now it has gotten easier. I've learned that there are so many people who care about you and are more than willing to help you get you the help you need. So the problem with this testimony, as sweet as it is that clearly the school district was not effective in encouraging discussions around mental health, to the point that Amber was afraid of even saying the word depression. And it's really the stigma that the state government has to address in order to help the future Ambers seek the treatment and care they need. Similarly, from a young man who wished to remain anonymous, as he reflected on what he wished he had known in high school, I'll read his statement right now. I wish my teachers, my parents, and my peers knew that my struggles can't be clearly explained in words. Sometimes emotions are so strong that they control everything I do, and I don't really have a say. In these times, please be patient with me. Again, we're seeing a person with mental illness struggling to deal with the consequences of his disease. And instead of having school programs to lighten his load, educating his parents, teachers, and peers, he's had to shoulder this additional burden. From an expert's perspective, Andrew Malakoff, the executive director of North Shore Child and Family Guidance Center, says, quote, teaching about mental health in schools and educating to reduce stigma is long overdue. There's great misunderstanding and fear among many who have erroneous ideas about people with mental illness. Consequently, young people suffering with mental illness walk around school feeling isolated, believing there's something inherently wrong with them that will never change. These children and teens often feel shunned, unlike their peers who have a physical health problem and who have others rally around them. End quote. So clearly, there's a need for government intervention, and Rachel will now discuss our proposal.
Thank you. So we're proposing that a provision should be added to the Nevada state education law to declare that mental health as well as physical health be included as part of health education in schools. It should be noted that the amendments we are proposing to the education law requiring schools to begin teaching about mental health do not include provisions specifying curriculum content. This law simply states that mental health shall be included in school health curriculum. The degree to which there will be additional guidance to schools regarding curriculum content will presumably be a matter for the Nevada Department of Education to resolve under its statutory authority to implement the law. We wanted to note that similar legislation to that of which we have proposed was signed into law on September 30th, 2016 by New York Governor Andrew Cuomo, as Chapter 390 of the laws of 2161, which, upon its effective date of July 2018, requires all elementary, middle school, and high schoolers in the state of New York to provide instruction about mental health to all students as part of the school health curricula. Let's not have our state lag and let our citizens of Nevada continue to suffer from disproportionate levels of mental illness because of our inaction. To assess the efficacy of this mental health policy on increasing mental health literacy in educational settings, we hope to see an increase in the proportion of students willing to seek help from professional sources, significant improvements in students and their parents, friends, and neighbors' awareness of mental health issues, and significant increases in student knowledge and attitudes. For major physical diseases, it is widely accepted that members of the public will benefit by knowing what actions they can take for prevention, early intervention, and treatment. Therefore, it is only logical that we provide the public an equal opportunity to know what actions they can take when mental health conditions arise. The proposed legislation will prepare future generations of students with vital knowledge against which to process their own life experiences, mental health challenges, and in some cases, mental illnesses. They will be fortunate because they will have the tools and resources to recognize when they or others are experiencing early symptoms of a mental illness and how to get help early. They will be fortunate because they will understand that mental illness is not something to be ashamed of, kept secret, ostracized for, or feared. They will be fortunate because they will know that there is hope for recovery and meaningful, purposeful living in spite of mental health challenges. They will be fortunate because in times of acute mental health crisis, they will know where to turn and will be assured that suicide, self-harm, and substance abuse are not their only options for recourse. The next generations of students will not only be better equipped with healthful knowledge themselves, but they will be change agents, ready to serve their families, friends, and neighbors for a lifetime.